total paradigm shift. Now, I'd like to say it happens with every client. It does not. It had that with me. So 6 months after my tapping, every day I'm telling my friend, I really want things to be better. I don't feel it being better. All right, that was however many months ago now. And for me, it's been this process of creeping up on me. And I think that happens with other clients as well. All right, so Roger Callahan developed his system, thought field therapy. He charged a lot of money for it. He had people using what he called algorithms, similar to what traditional Chinese medicine would do. Your anxiety is different from your anxiety, so we're going to create an algorithm just for you, and we'll create an algorithm just for you, tapping on the specific points that work for you. Did I say you charge a lot of money for that? I admire the people who really learned in the 70s and 80s under him. By the end of the 80s, early 90s, Gary Craig had taken Roger Callahan's training and said, you know what? Gary Craig was an engineer and performance coach. He coached people in golf. And he learned this tapping to help people with their golf performance. He says, you know what? It doesn't matter if everybody taps on the same points. So he created a much more simple system. And that's what you're learning today. That's what we did to start out with, and we'll do that again here in a few minutes. So the idea is that you can tap through all of the same points, no matter what the issue is. So really what I want you to take away today is please learn the basic recipe, that's what it's called. How fun is that? The basic recipe. Really, really learn it. Practice it for yourself. Do as I did. Try it on with everybody who has ache or pain or whatever, so that you really get good at demonstrating it and showing and practicing it for yourself. I think that really helps. Okay. You want to do another? Let's do another one. On the back sheet of your handout, the second to the last page, there's a worksheet. There should be a worksheet. Can I take it off? I take it back. It's page 10. So to get good at something, you need to practice. Here's your practice. You get to try this for yourself. I'd like for you to zero in on something that's been bothersome for you. Please don't make it a big trauma. Just something that's been bothersome for you. So on a scale from 0 to 10, it's more like a 5 or a 6, not a 10, for the purposes of today. Later on, you can go to the 10. Just for today, do a 5 or a 6. So that might be something like irritation with the drivers on the road today. It could be the anxiety like I felt coming in. That was kind of a 5 or a 6. It's not at this point. Really think of an issue, something that is bothersome for you, and write it down. Right? So the more you participate today, the better, the more you'll get out of this presentation. Write down an issue. Just name it. And the next few lines, you'll see openings for what are some of the thoughts that you have about this particular issue, what are some of the feelings that you have about this particular issue, and where do you feel this in your body? What's the body sensation that goes along with it? Fill those in too. And I know some of you are going to want to save the worksheet, so use the notes page or some other page. Or email me, I'll send you another worksheet. How easy is that? Yeah. It's all on the worksheet. So the thoughts and the feelings that are associated with the issue. So for example, tomorrow I leave for a trip to visit my younger brother. I love to fly, but I'm a little nervous. There's that anxiety. I wonder. Anyway, so I'm a little nervous because I actually haven't seen him for about 3 years. And he's 8 years younger than I am. So I left the house when he was pretty young. And we've kind of gone our separate ways for a very long time. Do you hear some of the things that could be involved in this now? So you all are kind of therapists, and you're thinking, oh, I'm starting to analyze. Good. That's what I need to do for myself. So this is teaching that process. So some of the thoughts about going are, what have I signed myself up for? I'm leaving on Friday and I'm coming back on Monday. Oh my goodness. What happens if? What happens if I don't like him? What happens if he doesn't like me? What happens if those are all those thoughts that are going through my head. There's the anxiety also about it. So I've got the feelings that are involved too. There's some other feelings. Do you hear some of the other feelings as I've said? Anxiety. What are some of the other feelings that you have heard in what I've said?
Fear.
Fear. Yeah, so there's fear and anxiety. All right, so I'm going to just kind of do a body scan, and I'm going to say, I usually fear and anxiety about right here, so that's that pit of my stomach. And I'm going to see what I can do to describe that. It's an ache. It makes my stomach ache. And then what I'm going to do is I'm going to rate it on a scale from 0 to 10, and it's really about a 5 or a 6. I did choose something that was a 5 or a 6. And then I'm going to tap on it. So we're going to do a group tapping. This is why it's important for you to fill this out. Because we're going to tap on my issue. You get to help me. Thank you very much. And then we'll check in on yours. Because this is energy. It's very possible that just focusing on mine and tapping on what I'm tapping on is going to help you too. Does that make sense? Is that Misery Loves Company or something like that? It's really about then creating an energetic field. So all of you are contributing to this energetic field. And we're holding an intention, then we're going to shift something. That's what I'm going to do. All right? So are you ready? This is our second practice. Remember the karate chop, and I'll do some refining now. So we got the karate chop, right? That's the first one. Do you remember what we do there? We state the issue and an affirmation. The recommended affirmation is, I deeply and completely love and accept myself. You can say, I love and accept myself, and here's the thing. I don't know about you, but I got clients who can't even say I love myself. So the wonderful thing about this is that it can be adapted. And there are some suggestions for options in the handout that you've got. All right, I'm just going to do some fine-tuning with points. So we got karate chop, right? And it's in between the base of your palm and the last part of the knuckle on your pinky finger. Top of the head is right in the center of the head. And I said before it's in that spot that used to be our soft spot when we were tiny, tiny. Right in the center, okay? Looks like you got it. The next point is called the eyebrow point. And if you push on your eyebrow and that bone, you'll find a little tiny notch. It might be hard to find, but it's going to be a tiny notch right at where your eyebrow starts. That's that point. Most of these points are notches. Right? So follow the bone around to where the socket ends on the side and starts under. That's the next point on the side of the eye. The next point, you almost have to poke yourself in the eye. There's this little teeny tiny U shape, little teeny tiny U notch under the eye, right in that socket. So you don't want to poke yourself in the eye, you want to go down a little bit and tap on the bone under the eye. The next point is in that space between your nose and kind of where your teeth start, or the roots of your teeth. That's a notch there too. There's another notch right above your chin, where your jaw or your teeth are. The next one, you can find it, is if you start with your collarbone, just go under your collarbone and feel for an indentation, just under your collarbone. This is where mine is. So again, follow your collarbone, go just slightly under the bone, follow it down, and feel for an indentation. That's the spot. So frequently what I do with clients, when I'm tapping and I'm going through pretty quickly, I'll make my hand into a C, and my thumb will hit one side, and my other fingers will hit the other side. Makes it really easy. The next point is about 4 inches below the armpit, so it's in line actually with the nipple. And for some people, that's really tender. Anybody feel a tenderness there? Yeah. So I'll do that, or I'll do this. Right? So I made a loose fist, and I just do this. I know it's kind of, this is great with kids, right? Let's do the monkey chicken. So those are the points. This is the basic recipe. Yes.
How do you find this one again?
Follow the eye socket. So go around the eyebrow to where right there, where it starts on the side of the bone. A little bit closer to your eye. Yeah, you got it. That's it. So most of these points are actually end points on the meridians. Most of them, not all of them. End points on the meridians. Any other questions? Yes?
You do both sides at the same time. I have a balance beam with you.
Yeah. And the answer is yes. And it's probably, it's a good idea. I think it's a good idea. So you can do, yeah, we could turn this into bilateral stimulation that way. Yes. So both at the same time or alternating. There you go, the real bilateral stimulation for those of you who do EMDR. Again, this is energy as opposed to a different kind of system with EMDR, but yeah. In fact, what I usually do is both sides when I'm tapping. It's kind of hard with this mic, so you'll see me do one side. Yes?
With acupuncture, sometimes when the point really needs to get stimulated, it's tender.
Yes.
Do you find that's also common? You can kind of trace which tapping point is tender to what the source is?
If you have the kind of sensitivity that you feel that tenderness, you could potentially trace it, yes. So I'm glad you asked that, because I wanted to talk about some of the clients that I've worked with. I have a pretty new client who came in a couple weeks ago, and she has a neurological dysregulation, which affects all kinds of things, imagine that. And I introduced the tapping to her, and she was so funny. She started tapping, and she was like, every point. She's like, it tickles. It's like that, you know how the dog does that's how too. So she knew she was hitting the point because you could hit here and it doesn't feel the same. So that's why I think this one, sometimes for folks, is pretty tender. This is also a place where lymph tends to kind of build up. Now, some people will ask, well, what is related to what? And you actually have a chart in your handout of the particular points that we're using, which meridian they relate to, and the general issue they tend to also tackle. I don't have that memorized. You know, I mean, I've told you how long I've been doing this. I still don't have it memorized. I don't know what the lung meridian does. I don't know what the liver meridian does. I just know that this really helps it. Other questions? Okay, so I'm going back to tapping. I'm going to call up again what I described. So the flight's going to be easy. I actually like flying. I love sitting and watching people. My brother and I have been texting back and forth. He doesn't talk on the phone. Do you have any relatives like that? They don't talk on the phone. So that's another layer of, what's this person really going to be like? I think I know. I mean, he's my brother. We have a few genes in common. But it's still there. So I'm saying all this because I really want to call it up and focus on it. So you ready to tap with me? And I'll make it general enough. And I want you to also remember what you were focused on before too. So review what you wrote down for your issue, some of the feelings that go along with it, where you feel it in your body, the body sensations. And we'll just tap using the basic recipe. Are you ready? So even though I feel this anxiety and fear, I love and accept myself. Nice. Even though I feel this anxiety and fear, I love and accept myself. Even though I feel this anxiety and fear, I love and accept myself. Okay. I feel this anxiety in my stomach. Next point is the eyebrow. Some people keep their eyes closed and that's okay, so that's why I'll call out the points now too. Eyebrow. I feel this anxiety. Side of the eye. This anxiety and fear. Under the eye. I feel it in my stomach. Under the nose. This anxiety and fear. Above the chin, this anxiety and fear. Collarbone, this anxiety and fear. Under the arm. I'm so worried about going to visit my brother. That was a long one. Top of the head. I'm so worried. This anxiety and fear. Eyebrow, this anxiety and fear. Side of the eye, this anxiety and fear. Under the eye, this anxiety and fear. Under the nose, this anxiety and fear. Of the chin, this anxiety and fear. Collarbone, this anxiety and fear. Under the arm, this anxiety and fear. You can stop there. I like to start this end at the top of the head, this anxiety and fear. You're going to take a deep breath. And I'm going to reassess. It's gone down. For me, it's gone down quite a bit. It's probably at a 2 or a 3. So here's what sometimes happens. What happens is that people start having this, well, really what I'm afraid of is, right? Yeah, so this is like when you fall off your bike and you skin your shin and you hurt your elbow and maybe you bumped your head a little bit. You're going to pay attention to whatever hurts most first. And maybe it's my elbow that hurts the most first, and then I realize after I've taken care of my elbow, oh, my shin was really messed up too. Same kind of thing happens with thoughts and feelings. We get to one layer, we're able to get that down to enough that we say, oh, there's that going on too. So you have two options. Stick with what you've started with, or chase it. Chase whatever drops in next. So I'm assessing. So like I said, all right, really what's happening is, what if I don't like it? What if I'm really uncomfortable being there and I have to stay till Monday? Because that's when my flight comes back. And by the way, it was an $11.50 flight because I used points. So you know where I'm going with this. I'm not paying extra to come back. So I have two choices. I can just keep tapping. So I want to show you what that looks like. I'll keep tapping on what we started with. You add to the initial setup statement. You add, even though I still have some of this, I love and accept myself. Or even though I have this remaining, whatever it is, I love and accept myself. Right? So we'll tap on that. Right? Even though I have some of this remaining fear, thank you. I love and accept myself. Even though I have some of this remaining fear, I love and accept myself. It's hard, you gotta chunk it down, don't you? So even though I have this remaining fear, I love and accept myself. This remaining fear, 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 this remaining fear. Take a deep breath and reassess. You know that energy is shifting when you get these kinds of signals. People sort of take a deep breath in the middle of tapping. They yawn. They start saying, oh, I feel like I'm falling asleep. Okay, feeling like falling asleep is kind of the opposite of anxiety, isn't it? People who have anxiety have a hard time falling asleep. So those are good signs. Questions or comments up to this point? Yes?
The NIH has a department of alternative medicine. Is this an area they have studied?
Identified. So the National Institutes of Health started probably, it's been a few decades ago, the Complementary and Alternative Medicine, which in 2014, December 2014, changed their name to Complementary and Integrative Medicine. And I don't know that I don't think they're funding. They're having a hard time keeping up with so many of the different modalities that are out there. However, this is part of my, how about if I do this? Because I'm going to talk about research. That was a great one. Thank you for that. So in general, there's a good body of research on this. More than 100 investigators with more than 60 published studies in peer-reviewed journals, 7 different countries. 20 of the published studies were randomized controlled trials, which are considered a gold standard. And I love this, 98% of the studies have shown it to be highly effective. Those are pretty good odds. So I did some sampling of studies, but where you can find studies, this is not in your handout, so this is a place that you might make notes. Some of these the websites are in the handouts, but not under specifically this. The 2 major places to find studies are energypsych.org, that's the Association for Comprehensive Energy Psychology. Under resources, there is a wonderful several landing pages on the research. And they actually have copies of the studies or links to the specific studies. And then the other place, so here we had Gary Craig forwarding what Roger Callahan has done, and I'm so grateful for Nick Ortner. He is neither a psychotherapist, he's been using tapping. He created a documentary kind of film several years ago, and now has a website, thattappingsolution.com, and he's got research studies posted on his website as well.
Can you repeat that, please?
Yes, thattappingsolution.com, and then that / research. So I think on one of the final pages of the handout, there should be websites. So these websites are definitely on there. So the first one, like I said, is energypsych, energypsych.org, and thetappingsolution.com. David Feinstein in 2012 wrote a beautiful summary article about energy psychology, including information about most of the studies up to that point, and there have been more since then. So Dawson Church is one of the primary researchers also in the field. He got together with Young and Brooks, created a randomized controlled trial, a 1-hour EFT session versus conventional talk therapy and a control group. And what they found was that the meridian tapping, so it was more TFT than EFT, or it was actually clinical EFT. So you're learning a clinical application of EFT. Reduces cortisol. He was able to measure cortisol levels. Reduces cortisol levels by an average of 24%. And a high of 50% in 1 hour. Now here's what happened. I love hearing Dawson Church. He's from England, so he has this wonderful British accent, and he has this dry sense of humor. The story he tells is, after we did these trials, we sent the blood work back to the lab, and they waited for the lab to get back to them. They waited and they waited. They waited 2 weeks. It shouldn't have taken 2 weeks. But here's what happened on the other end. On the other end, the lab was like, wait a minute. Either the samples are wrong or our instruments are wrong, because this can't be happening. So it's astounding, the kind of results that they are getting with EFT. So at the very least, we know that it reduces cortisol in the body, the stress hormone. Pretty good. We've got a lot of stress in our lives. Another study about thought field therapy in large-scale trauma. There's a group of folks that are going to war-torn countries, Rwanda, to help survivors of genocide. And they're finding that teaching people thought field therapy, which is the precursor to EFT. A year later, they come back and the effects hold. A year later. So that doesn't happen with CBT. The studies on CBT showed that people start to bounce back after 3 to 6 months to their old thoughts. They're not finding that with TFT and EFT. I think that's pretty good. That's a lasting change. Again, it's not happening with everybody, but they're getting a 95% healing rate with survivors of genocide. ASEP, the Energy Psychology Organization, sent a team up to Sandy Hook shortly afterwards and taught family members, teachers, counselors, EFT after that. And that community has really done a lot of healing.
Susan.
Yeah.
So in the research on post-traumatic growth versus post-traumatic stress, we see the difference is at 33% to the 66%. based on personalities going into the trauma?
That's a great question, and I don't know the answer to that. I don't think anybody's done that kind of study yet, Suzanne.
That one's next.
Yeah, there are a lot of next ones.
Yeah.
Yeah. So there have been a lot of. So I'll back up, because the APA actually refused to have EFT or energy psychology as a subdivision for probably 15 years. The members of ASAP, started by psychologists, went back to the APA and said, we meet all of your criteria, and they still got refused until 2 years ago. So there's finally an acceptance for APA of continuing ed to be used for psychologists. So there's not yet a subdivision. However, there is a subdivision for complementary and alternative therapies. And I think, that's a nice sneak in. So there's 100 studies, 60, so it's still significant enough, and there's so much more that can be done with this. Yeah.
My question is, can this be used for people with dementia?
Can it be used for people who have dementia?
Well, because they're it's tough, but could you teach them the techniques? I mean, I know myself, thinking that might.
And I would say I would try it. I don't know how effective. I don't work with dementia folk, but I would start looking to see what some of the research studies have been done with folks with the different populations. Dawson Church also has a website. It's called EFT Universe. EFT Universe, I think, .org. And people report all kinds of, people report on their experiences, not necessarily research, but you might find somebody who's been using it with folks who have dementia. That's a great question. So that client I mentioned who has all this neurological dysregulation, what we started with was asking her body to start regulating itself. That's kind of what she's trying to do with the medication. She's asking it through medication. So why not ask it directly? Our bodies are programmed by the thoughts that we think and the beliefs that we have. So that's where I started with her. And she's only been tapping for a couple of weeks, but what we had to do is then to start to say, you know what, this is really an easy thing. Because from the first time she came in to the second time she came in, she's like, well, I tapped on it just once or twice. I'm like, yay! Did you do that with clients? Yes, you did once or twice, that's awesome. What a hurdle that folks often have is, oh gosh, this is gonna take a while. All right, the next time we tap, I would like for somebody to put a clock on it. Because you know what? It might take a minute and a half. It might take a minute and a half. And when I said that to her, she's like, oh. So what do you do during your day that takes you only about a minute and a half? She said, well, I take my medication in the morning and in the evening. And I said, oh, those would be really great times to tap along while you take your medication. I do know that EFT has been used, and thought field therapy has been used with cancer patients to reduce the effects of the cancer treatment. In fact, Roger Callahan's wife, who was carried the torch because he died a couple of years ago, had her treatment, and the amount of medication that she ended up having to use was dramatically less as she used TFT along the way. She was consulting with her doctors all along the way, and that's what we need to make sure that we're careful of, is that we're not practicing medicine as opposed to counseling. So our focus needs to be on the thoughts and the feelings and the body sensations as well. So Dawson Church again used EFT, and his study in 2013, his article, was really about how he thinks the mechanisms of EFT. People don't really understand yet how and why meridian or energy-based therapies work. But that's part of what they're trying to figure out is what the mechanisms are. So I think in indirect answer to what you asked, it's that, what's the meta? The meta is, why is this working? How is this working? And if we could figure that out, then maybe we can start doing more specific studies. I think it works from the ground up too, but EFT has moved from a real fringe therapy when I was practicing it in 2001 to something different now. The fact that we can have this here and as many people are here, I think is awesome. So what Dawson believes is that their main ingredients of clinical EFT, and the reason that it works, are exposure. So we know that CBT and exposure therapy helps. In some ways, they think because what it does is to start to shift the amygdala's response. So exposure, because we're keeping in mind the issue. A cognitive shift, which is part of what happens with CBT. And then the acupressure itself. So there's this, and oh, by the way, we think the acupressure itself is working. Okay. So he thinks that those are three major pieces to it. So there's this study that was done and revisited in 2013 now here I'm getting into some of the science, and I apologize to some of you, but some of this gets really exciting for me. And then I get over my head because I never studied biology, and I'm still learning that. So there's a vascular system in our bodies that in the late 80s, it was discovered that there's this thread that runs through our vascular system. And there are places, kind of nodes, they're not called nodes, where you can have an intervention and it makes a difference. It shifts the energy in the body. They think that they've discovered the meridians and the points through this. So there is starting to be some biological support for an energetic system. I'm trying to do a time check here because there's one more demonstration that I want to do with you all so that you practice a little bit more. Dan Benor studied also energy psychology, and he's also trying to come up with an explanation of why it works. I'm trying to equip you with some words to use in your clinical practice. Are you hearing that? I hope that you're hearing that. That he thinks, based on some of the research that he's looked at, that EFT modifies thoughts. People do change their thoughts, so we're focusing on their thoughts. There's some psychological conditioning that happens as we have an intention to shift through tapping. Then that is a belief in and of itself, and we pair that with an action. Then that's psychological conditioning in and of itself. Do you hear that? An expectation. Here I have this intention. I expect some things to change. I love the skeptics, though. I have to tell you, I love the skeptics because what happens is they're, this is bunk or whatever you want to call it. That's an old word, isn't it? I love the skeptics because they'll come in like, yeah, nothing works. I don't know if this is going to work, but you mind if we try it? What do we got to lose? And when I get, well, I feel a little better. That's pretty good. because you didn't feel that way when you walked in 5 minutes ago. So we talked about distraction. Maybe it's a distraction technique, so you could use that in your notes. The tapping on the acupressure points themselves, again, there's this unknown mechanism for that. And then we do know that there are shifts in the biological response. So that Dawson Church study with the cortisol does indicate that the cortisol is reduced. Yes?
Talk a little bit about how distraction is effective. How do you use it?
How do you use distraction? Okay, that's the question. The way that I would use distraction is, actually I used it just yesterday in a session with a client, actually Tuesday. So I had a client who was starting to really well up with, we did some tapping, and it actually more activated her rather than deactivated. And I have two choices then. If somebody's more activated, I tap more, or I really go back to, I distract. So that client had talked about an experience that she had had in the previous week with her husband that was really a good experience. So I said, tell me more about that. That's a distraction. I distracted her from what was happening in her internal system to create a different set of feelings and thoughts in the moment. Does that make sense? So another way that tapping can be used, here's what I like about it. So we talk about clearing all the junk. We can tap in that too. So we can reinforce the positive thoughts that we've been having. I think that's cool. Answer your question. All right. Oh, I do want to say this, that the 2015 Nobel Prize in Physiology or Medicine has gone to an acupuncture researcher. Isn't that great? A woman. And there's even a YouTube video of the ceremony itself. So I want you to know that tapping can help with relieving stress, fears, phobias, anxiety, panic, depression, mood disorders, food, drug, alcohol, substance abuse, or cravings, relationship problems, effects of stress, can help with work and academic performance, health and well-being, creative and intuitive abilities, confidence and self-esteem. When I read that and I say that, I hear, oh my goodness, we've got the magic bullet. It doesn't work for everybody. I say, this is another tool for your toolbox. So with good tools, they're going to help a lot of people, but not everybody. I do have clients who are like, I don't think so. Okay, I'm not pushing them. I secretly think, oh, little did they know. So I said before, this has a different foundation. It's really about integrating and thinking about things on a much more holistic level.